everyone. My name is Chris Dawson. I'm one of the co-founders and CEO of Dimensions Health Centers. We are very much a retreat model, and that retreat model is specifically intended to be set in nature, and even more so to be psychedelically assisted therapy in nature. We are a Canadian company that is opening a retreat center 2 hours north of Toronto, hopefully opening up on May 1st. And if all goes well, in the next couple of weeks, we'll also be planning to open up a second retreat center in Costa Rica on June 1st of next year. So that's what we're all about. I'm equally excited to be on this stage with all of these great people and to be able to chat with all of you.
All right, so psychedelics are not a one-size-fits-all magic bullet panacea sort of deal. And the big question is, how do you manage clients' expectations when they come in so hungry for healing that they're willing to try anything? And how do you ensure that earning profits doesn't interfere with determining who's a good fit for psychedelic treatment?
I like the way Marisa framed the question. Individual expectations versus the profit motive. My background actually is traditional treatment. And I don't think many people would realize that the average length of stay has been defined predominantly by insurance companies, not by practitioners. And so I think we get a sense of what might happen if the profit motive gets ahead of patient care, therapeutic integrity. At Dimensions, our approach is to put the program first and foremost, and the delivery of the program by the professionals, psychedelic assisted therapy trained professionals. Put those at the core of what we're doing. We want people to be hopeful about this alternative. None of us would be on this stage if we didn't want individuals to be hopeful about the promise of plant medicine. But that doesn't mean that you don't properly set expectations. So if somebody is coming to a retreat at one of our centers, we start to hold their hand weeks ahead of their arrival. We put them through a thorough assessment process that may or may not indicate that they're not ready for plant medicine. Maybe they're ready for some psychedelic-inspired therapy, complementary modalities that will allow them to warm to the idea. But the assessment must drive the process, not getting that guest into your retreat center. If the assessment is done properly, then their experience with the plant medicine, guided by the program, can be gauged by the professionals that are sitting with them through their experience. And so set expectations properly at the beginning, guide them through the process, and triage their capacity to begin their journey towards the plant medicine, and hold their hand through that process. And don't be afraid to hold their hand, at least not metaphorically, because that's the essence of putting the individual first. And if something goes sideways during the retreat, then you focus on the individual, because that's what the plant says to us we should do. Circle back to the individual and reset, guiding them through that journey. If you do that, whether you're a nonprofit or a profit-seeking enterprise, you're going to be doing the right thing. You'll be doing the thing that the medicine is calling all of us to do. That's our approach.
Each of you, please speak on your business model and how will it serve your investors and your clients? And do you have any social value missions, and how is that reflected in how your organization is structured?
If you believe that the medicine calls people, then we don't get to choose who should be coming through our retreat center, for example. We do get to choose, on the other hand, who our investors are. There are investors that are patient, There are investors that are ethical. There are investors that are passionate about plant medicine and psychedelics. And if you work hard and seek out those investors, then you're going to create not just a clinical or a hospitality or a retreat model that works, but you're also going to establish an economic model that works. One of our investors recently was looking at our financial projections and he said, "What's this thing, reciprocity?" And I said, "Well, that's how we pay for the hundreds and thousands of years of research and clinical trials that have taken place before us." And he said, "What do you mean by that?" And I said, "The retreat model is a firmly established model. It may not have passed through all of the filters that Western science would like it to pass through. But I think we all know it's a pretty demonstrated model. And that number doesn't prevent those investors from having optimism about what their returns are going to look like in the future." When I used to run a traditional treatment center in Canada, and it was on a trip to, I think Daniel Carcillo talked about doing ayahuasca earlier in Tarapoto. I went to a conference in Tarapoto that had neuroscientists and neurobiologists and traditional healers and shamans. And the scientists were taking great pains to make sure that we weren't talking about cultural appropriation for indigenous practices. Finally, one shaman who was not fluent in English stood up and said, "Please stop. We're here to spread the word. We're here to spread belief in the medicine. You don't need to continue to apologize." But he did say one thing. He said, "Please don't put me out of a job." Because the pursuit of the magic molecule turns into big pharma, and big pharma turns into big agriculture. And we don't need any other reasons to destroy the Amazon. Maybe psilocybin would survive because it seems to be everywhere. But let's protect their job, and let's do a small part to help assist those that came before us. And if you can't explain that to an investor, then you don't have the right investor.